Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today's topic has to do with Bell's palsy and avitaminosis. When we talk of Bell's palsy, it's another way of saying the partial facial paralysis and the situation of vitaminosis when there is no certain vitamin are certainly deficient. So it's a very serious concern because majority of time Bell's palsy is not known. It can happen to anybody. It is not something you can say this is the cause, but it is something that affects the seventh nerves, the cranial nerves, and that much is known, and inflammation. So in that region, you want to talk about something that probably has an effect on the neurology, something that would affect the nerves. A study that can bring about this would be so much surrounding that area. But so far, effort has been made and positive results have been gotten that indicates that avitaminosis is really very important as a cause of Bell's palsy. So as we go into the slide section to know which of these vitamins or the one that should be seriously taken care of and how the laboratory can also help in the measurement of all these vitamins is what shall be discussed in the slide section. So if you like my presentation, press the like button, subscribe, and more information will come from me.
The outline, objective, introduction, risk factors, avitaminosis review, lab diagnosis and prevention and recommendations. The objective, to create more awareness about Bell's palsy and expose its correlationship with avitaminosis, necessitating measurement of some essential vitamins. Introduction. Bell's palsy is a neurological disorder that occurs when something interrupts the signal from the facial nerve, which animates the muscles in the face, known as cranial nerve 7. It also plays a role in taste and sensation in the hair. This condition appears suddenly, so it is acute and can progress rapidly, and usually affects just one side of the face. For that reason, it is sometimes mistaken as the effect of a stroke. It is possible but rare for Bell's palsy to affect both sides of the face. You can see from the diagram the nerves as they show, and then you can also see this palsy. It is that nerves because the nerves will always control the muscles, and once these nerves are affected, inflamed, whatever happens to injure it, that's what we now show as Bell's palsy. Let's talk about avitaminosis. Avitaminosis is a condition of lack of or deficiency of one or more essential vitamins. It can occur due to a diet lacking in essential vitamins, malabsorption of nutrients, increased vitamin requirement during period of rapid growth, childhood, pregnancy, or increased vitamin losses, chronic diarrhea, excessive sweating. These are points to be noted, especially when we are talking about the prevention of avitaminosis. Vitamin A, for example, will cause night blindness, dry eye, and impair immune function. Vitamin B, beriberi, B3, pellagra, and B12, pernicious anemia, megaloblastic anemia, and today we will find out they affects the neurons as well. Vitamin C, scurvy. Vitamin D, rickets and osteomalacia. Vitamin E, that is the neurological problems per se. Vitamin K deficiency, bleeding problem. Though vitamin E has been included in muscles and other problems that of recent, it has helped increase even the sensation that you have. The risk factors are high blood pressure. If you have high blood pressure, you're prone to experience diabetes, pregnancy, being overweight, obesity, viral infection, autoimmune syndrome, living with an upper respiratory tract, trauma, tumor, so on. Yeah, vitaminosis review. This is very necessary so that we know how the vitamins could be essential to prevent Bell's palsy. Palsy can be linked to avitaminosis, vitamin B12 in particular, which can cause neurological issues including abducing nerve palsy affecting eyes movement and even facial nerve palsy. Abducing nerve palsy, a deficiency can cause a condition called abducing nerve palsy, which affects the 6 cranial nerves, unlike Bell's palsy that affects the 7, especially the 6 is only for eye movement. Facial nerve palsy too, deficiency, the B12 deficiency can also contribute to facial nerve palsy, causing weakness or paralysis on one side of the face. Other neurological symptoms, vitamin B12 deficiency can also cause ataxia, just like vitamin E, loss of coordination, sensory loss, and even cognitive impairment. Now to vitamin A. Vitamin A deficiency or hypovitaminosis has been linked to facial nerve paralysis, especially in infants with cystic fibrosis. As you see the little boy, you can see the facial paralysis. Another vitamin of importance is vitamin D. It plays a role in the regulation of neurotrophin level. That is a recent finding by researchers. Studies demonstrated that egocalciferol and cholecalciferol promoted axon sparing, regeneration, and induced a significant effect. Lower vitamin D level may have a negative effect on recovery. So, particularly in patients with advanced grade Bell's palsy. So, for prognosis, measuring this vitamin D level and also making sure that it's increased in quantity so that the patient will quickly resolve from this paralysis. So let's talk about vitamin E. Vitamin E is an antioxidant that helps protect nerve cells. Deficiency can lead to nerve damage, potentially affecting the facial nerves. No study has linked it to facial palsy, but if lacking, could also affect the prognosis. That is, you try and measure the vitamin E so that the prognosis of this Bell's palsy will quickly resolve. Will be very short. Vitamin C is also considered as an antioxidant, anti-inflammatory, and you understand that Bell's palsy has to do with the inflammation of that area, the cranial nerve 7, and immunomodulator, and it hastens recovery of neuritis caused by herpes. Herpes is one of the viruses suspected to cause Bell's palsy. Bell's palsy too has immune inflammatory background. That is what I just explained. Serum vitamin C level should be checked in every patient with Bell's palsy, and that is the recommendation of that research. The lab diagnosis. As usual, for majority of lab tests, you collect the blood sample venipuncture, blood test to determine a vitaminosis. You may need to fast before some certain vitamin tests are done in the laboratory. The quantity could even be finger prick that will be you collected. Other tests include urine and or hair tests. Tests are also done to confirm underlying conditions that could be the risk factor for this, and probably, if corrected, would help prognosis, such as diabetes or lymph disease or viral infection that could be suspicious as cause, tumor, or even injury. If it's present, MRI or CT scan to find out if there is a structural cause for your symptom, just as is shown there, the CT scan. Electromyography to determine the extent of the nerve involvement. Yeah, and finally, recommendation. Talking about prevention, we must factor in all those things that would affect the level of our vitamins, and invariably we are preventing Bell's palsy. In pregnancy, especially, though that is a given that vitamins are given to these pregnant mothers, and when children are growing up, they need so many of these vitamins. So it is advisable that children are given. One must consider also how to avoid the risk factors, though it is common between ages 15 years and 50 years, which could be considered a risk factor. We must try to avoid chronic diseases, high blood pressure, overweight or obesity, facial injury, and oxidative stress that could deplete our antioxidants like vitamin C, making us prone to Bell's palsy. Vitamin B12 is not made internally but found in animal products or dairies, so we need to include it in our meal as supplement if we are vegetarians. Laboratory tests, vitamin tests, are necessary for quick recovery because they have been found to aid quick recovery. That is when you are talking of the prognosis. The prognosis is how long it will take for this illness to resolve. Usually, it doesn't take long, weeks, but when one does not really take care of it, it could last for months. So it's necessary. And if you like all that I'm presenting, there are so many videos for you to watch, going to 172 now and still counting. If you like it, you should also subscribe. Thank you for all.